If you or a loved one has cancer but feel lost, and you don't understand the diagnosis, the treatment options, the side effects of treatment, or have other questions on your mind, then Online Oncology is the best place to find the right answers. Through a series of videos, we will help you every step of the way. Now let's get started with today's topic.
Hello, my name is Dr. Riaz and I'm a hematologist and medical oncologist. Today I will be talking about a very important topic, the breast cancer. If you are watching this video, the odds are that somebody in your family, your friends, or you know very close has suffered from this disease. That's make it very important for you to listen and spread this message. Last year, there were more than 1.7 million new cases of breast cancer in the world. There were about 266,000 new cases of breast cancer just in the United States, and more than 40,000 women lost their life to this cancer. And do you guys know that it's not only the females who get the breast cancer? In fact, 1% of all cases of breast cancers are male. And when you are looking at 266,000 cases per year, these are a lot of patients which will be males who will get breast cancer. Now for males, they are also pretty much treated on the same principles as the females. So the treatment does not differ much. Now what are the signs and symptoms of breast cancer? It does not present with a single set of symptoms, and different women may experience different symptoms. Some women feel a lump in their breast. Some women feel pain in their breast. Sometimes there is a lump in the axilla. Sometimes it just comes up what looks like to be an infection, and the doctors give antibiotics, but it doesn't heal. In fact, it keeps growing and causes ulcers on the skin. And sometimes, in fact, about 40% of the time, we find it just on a screening mammogram when the women had no symptoms. Speaking of mammograms, that's exactly why mammograms are so important, and for women to get them every year, because they can detect cancers which were otherwise completely asymptomatic. Now, there are several risk factors for somebody to develop breast cancer, and there is an increasing incidence of breast cancer with age. Your family history is very important. If somebody young in your family has breast cancer, all the more reasons to start mammograms at an early age. The more hormone exposure you have during your lifetime, the more estrogen exposure, the more risk of developing breast cancer. Women who are never pregnant have more risk than women who are even pregnant just once or have a child. How do we diagnose breast cancer? There are different diagnostic techniques by which we can diagnose breast cancer. Mammogram is the most important. So anytime there is a lump, whether you find it or your doctor finds it, a mammogram is ordered. And there are two types of mammogram, a screening and a diagnostic mammogram. The diagnostic just has a more detailed information. And you can also do ultrasounds. And if you find something abnormal on the mammogram, then an ultrasound is always done. And the ultimate test to diagnose breast cancer is to biopsy any suspicious lesion that you may find on the mammogram or ultrasound of the breast. Once you get the biopsy, the pathologist looks at the specimen under the microscope. They also stain the specimen, and that's how they accurately diagnose breast cancer. Now, there are different types of breast cancers, and so to speak, breast cancer in two women can be totally different disease. And how do we determine how this cancer is going to behave in each woman? There are several techniques to do that. The first piece of information is to know the hormone receptor status. There are two types of hormones, estrogen and progesterone. And the estrogen receptor are expressed on the surface of the cancer cells. Same is the progesterone receptors. They are abbreviated as ER and progesterone receptor as PR. Then the third key information that we look for any case of breast cancer is a HER2 neu. And based on the positivity or negativity of these estrogen receptors, progesterone receptors, and HER2 receptors, different types of breast cancers are diagnosed, and that's how we know how each breast cancer is going to behave. Because two women with breast cancer, their disease may behave completely opposite. So in just one word of breast cancer encompasses so many different disease behaviors. Similarly, when we do the biopsy, the sampling of the lymph nodes in the armpit is very important. And that is almost always done to make sure the cancer has not gone from the breast to the lymph nodes in the armpit, because that's the first site where it goes. There are different stages of the breast cancer, generally speaking 4 stages of the breast cancer. The first 3 stages of the breast cancer, a cure is possible. In the stage 4 setting, generally the cure is not possible with a few exceptions. Based on the stage of the cancer and based on the information on estrogen receptor, progesterone receptor, and HER2 receptor, your doctor will determine how your case will be treated. You may have stage 1 breast cancer, and another person may have also stage 1 breast cancer, but they might be treated entirely differently. One patient may receive chemo, the other may not. So that's why these are the key points that you need to know about your cancer, and your doctor can explain that to you. Now, coming to the treatment of the breast cancer, here I will cover the treatment of the stage 1, 2, and 3 of the breast cancer. As I just stated, that the stage and the estrogen, progesterone, and HER2 receptor status determine how your cancer will be treated. In general, if you have an early stage breast cancer, then you will get at the minimum 3 different modalities to treat your cancer. First modality is doing the surgery. With the surgery, our goal is to remove the breast cancer and also sample the lymph nodes in the armpit. And that lymph node is called sentinel lymph node. Then after surgery, we get more detail on the pathology specimen, and that's when we decide which patient will get the chemo and which patient will not get the chemo. If you have what we call a triple negative breast cancer, meaning your estrogen receptor was negative, your progesterone receptor was negative, and your HER2 was negative, that's the most aggressive type of breast cancer, and doctors may use the term triple negative breast cancer. These cases almost always get chemotherapy and they benefit from it. However, if you have estrogen positive, progesterone positive, and HER2 negative, your doctor, especially in the stage 1 and stage 2 setting, may not offer you chemotherapy since there is no advantage of doing that. Now, there are other different tests that the doctors can do to determine if you're going to benefit from chemotherapy or not. And some of the commonly used tests, like there is one called Oncotype DX. There is another one called MammaPrint, and then there is a third one called EndoPredict. And these are all the tools that the doctors have to determine what is the best treatment program for you. Now, once you have gotten surgery, then the doctor determines about chemo. If you need chemo, then you get chemo, and after that, the third modality is the radiation. Radiation improves the odds and prevent the cancer from coming locally in the breast or in the armpit. That's why whenever in the right setting, radiation plays a huge role in keeping the cancer from coming in future. Once you are through your surgery and chemo if applicable and radiation if applicable, then in the 4th phase, you will need hormonal treatment. In the hormonal treatment phase, which is a very long phase, 5 to 10 years, you will be taking a pill every day which blocks the effect of estrogen. There are several different types of anti-estrogen treatments that are available, and your doctor will determine which one will serve you the best based on your cancer type, based on your age, and based on the other medical problems that you may have. a couple of other very important points in the treatment of breast cancer. Vitamin D has shown to be a big player, and women who are low in vitamin D over the long term have a higher incidence of their cancers coming back. Hence, your doctor should check the vitamin D levels, and if they are low, you should be on vitamin D replacement. In my practice, I always put women on vitamin D replacement, regardless if they have low vitamin D levels or not. Now I will discuss a little bit about the stage 4 breast cancer. Now, stage 4 is the last stage of the cancer. And unfortunately, majority of the people who have stage 4 cancer is not a curable disease at this point, with a very few exceptions. And usually those exceptions are that it is a stage 4 cancer, but the cancer is only present in just one piece at a distant site from the breast. And then you can, either surgically remove that or do the radiation at that. It's about 1/3 of those people who fall into that category will be lucky enough to get cured. So generally speaking, stage 4 breast cancer is not curable. And in this situation, our goal is to control the cancer with the most gentle treatment possible and get as much control as possible and as long as possible. Again, every stage 4 cancer, some people will require only hormonal treatment, and some people will require chemotherapy, and some people will require a combination. There are many problems that can happen along the course of a stage 4 cancer. When it's spread, it can cause different problems. For example, it can go to brain and cause symptoms, severe symptoms that need to be addressed rather on an emergent basis. It can go to the bones and cause severe pain in the bones. It can go to the lungs and cause chronic cough or other problems like recurrent pneumonias. Based on your case, whether you need just the hormonal treatment, which generally is the case for the slow-growing type of cancers, or you need chemotherapy, which is the case for fast-moving type of cancers, this is something that your doctor will decide on a case-by-case basis. The treatment of breast cancer has evolved over the last decade or so, and it is just not the chemotherapy or hormonal therapy we are using right now. Earlier in the video, I told you about HER2/neu, and HER2/neu is a target on the surface of the cancer cells. Now we have the medicines to target it. And this has actually revolutionized the treatment of this particular subtype of cancer. Historically, these cancers were very aggressive. They still are aggressive. However, the outcome are much better now compared to a decade ago when we were treating all these cancers with chemotherapy. However, now patients get chemotherapy, but in addition to that, they get what we call targeted therapy. And this has completely revolutionized the treatment of breast cancer. So that's all I have for the breast cancer today. If you like this video, please make sure that you are sharing this video with the person that's in your friends or in the family so that you can spread the knowledge. Knowledge is very important for you to make good decisions about your health, or it is also very important to engage in a meaningful conversation with your doctor. If you have any questions, you can email me at onlineoncology@gmail.com. You can also visit my website, onlineoncology.com. You can also subscribe to my channel on YouTube, and you can ask me any questions either by email or by putting comments below in the video, and I'll be happy to answer your questions.
We hope you find this video helpful. The more knowledge you have and the more informed you are about your condition, the better decisions you can make about your health. Please spread the message to other people that may also benefit from this knowledge. We have covered several topics about cancer care in other videos. To learn more about these, visit our website, www.onlineoncology.com. You can also visit our Facebook page, YouTube channel, Instagram, and follow us on Twitter on onlineoncology.com. Be smart, fight strong.